Hello, this is Susan Knowles from Cochise College Nursing, and welcome to this podcast. Today, we'll be talking about medication administration, the first chapter in Unit 3, where we'll begin to specifically talk about medication administration and dosage calculation. Medication errors result in anywhere from 44 to 98,000 deaths per year, and about 540,000 or 500,000 medication errors have to do with children's dosage calculations every year. So that's why it's critical that we talk about the administration of medications, because it's a lot more than just putting a pill in a pill cup and delivering it to our patient or client, whichever word you want to use. It can result in anywhere from emotional to legal consequences, and it's the most common cause of injury, despite the fact that there are so many safeguards in place, including technology. So what are some of the reasons why we make mistakes when we give medications to our patients? It's either because there's a miscommunication that leads to death of our clients. It's the leading cause of death of our clients is miscommunication. She's everywhere, that little miscommunication. But it's also the failure to actually identify our patient. And you think, well, that's not so difficult. You go in a room, there's one person in the room, you ask them their name, and then you give them their medicine. Well, they can't always answer. They're not always communicative. And there sometimes are two patients in a room. Sometimes there are names that are similar. And when you work in a fast-paced environment, which nursing is, we forget and we make mistakes. We cannot rely on our memory. So lack of information about our patients, their allergies, their actual medications. Sometimes we just don't know that medication and we feel like, well, I'll hurry up and give it. I'll look it up later. Well, that won't work either. Or as I mentioned, that people's names are similar, but so are medications. And we don't use a standardized approach to giving medications, and there isn't always one. From one facility to another, sometimes from one medical unit to another, some procedures are slightly different, so that makes errors easier to occur. And then lastly, it's that we calculate the medication wrong in the first place, and we don't adhere to the basic rights. You're going to hear this term over and over and over again until you're sick of it, called critical thinking. But what we talk about when we're talking about critical thinking is the ability to actually be reasonable in our thinking, the willingness to challenge wrong orders, to get clarification, to also get the right tools that we need in order to administer our medication. Are we using the right syringe? Are we using the right needle? Critical thinking is that process of thinking that includes, as I said, being reasonable and rational about what we're doing. If it doesn't sound right, then there must be something wrong. We need to ask somebody else. We need to clarify. And we don't just do it because we think somebody wrote it down and told us we had to do it. We think about it. We say, does this make sense? Does it sound correct? And then we validate that information before we do it. And we need to be focused and organized in our thinking. When we give medications, we need to think about a lot of different things. It's not, as I mentioned, just giving a pill to one person. We have to consider what route do we need to give the medication, what time, about the age of our client. Anytime you get to the age extremes, pediatric or the elderly, we also have increased risks that they will not tolerate the medication as well. Dosages need to be more exact. We need to think about the nutritional status of our patient. What about the absorption as well as the excretion of that medication. That's the reason why you're also taking pharmacology, so that you understand better about the whole picture of the actual drug itself. Then we need to think about sometimes the sex of the client, whether or not this medication is appropriate because of the gender of the person. And then are there any ethnic or cultural considerations that we need to think about when we give the medication? We know that over 2/3 of all prescriptions and medications, over-the-counter medications, are ordered for the elderly. And we expect that population to increase as the years go by. And as people age, their physiologic function changes as well. They have changes in circulation, their ability to absorb, metabolism, as well as the excretion, meaning getting rid of the drug either through the kidneys or through the urine, through the liver. So depending on where that drug is excreted, it may not get excreted as quickly as it once did in a more physiologic, healthy body. And then we need to think about the lowered body mass of the elderly sometimes, especially in children as well. And then what about the mental status of the elderly? Are they able to remember to take their medications or to not take their medications under certain circumstances? And that comes about when we start talking about patient teaching. Discussing further special considerations for the elderly, they may need a lower dose. They may need special delivery devices, things that they can read, because as we all get older, the printing seems to get smaller and smaller and smaller. So they may need visual aids to help them read the label, and as well as those lids that open more easily, because trying to twist the lids off become more and more difficult as people age. And then when we do teach them about medications, we need to give them enough time to actually absorb the information and then come back and then ask questions. Because we know that the elderly is really prone to that polypharmacy, they're on a ton of different medications. Some medications interact with other medications. There's a specific list called the Beers criteria, which is talked about in your text, and I attached a copy of it to this podcast under the attachments. And there are certain medications that the elderly should be cautioned against using, or as prescribers, we need to be more careful in prescribing certain medications. Some of the memory aids that are used for the elderly, as well as for all of us in our busy lives, are pill counters, if you will, the ones that are the days of the week that are demonstrated here on this slide. Twisting things, which I don't really recommend, but that's another device there, as well as a pill timer. This is a pretty cool device. This is where the lid of the pill bottle actually has the time in which the person is supposed to take the medication, and it's actually got an alarm on it, so it can remind the person to go ahead and take their medication. We always need to keep in mind the 6 rights of medication administration. Anytime you do not stay on that course of making sure that you're checking your 6 rights, you are at risk for making a mistake. In fact, you have already made the mistake. We need to give the medication to the right person at the right time through the right route. We need to give them the right dose, and then we have to not forget, we've got to document. Because if you forget to document that you gave the medication, you go off shift, or you're called away to a meeting, guess what? Someone who's taking your place while you're absent from the unit, they look at their medication administration sheet and they say, oh, Sally forgot to give Mrs. Jones her medication, so I'll go ahead and do that while she is gone from the unit. And guess what? Now the patient has been given 2 doses of a medication, and now there's not only been an error, but also a possible injury to your client. One big right that we all have is the right to refuse. Now we hope that when someone refuses, they have their full mental capacities to make an educated reason why they're refusing. And that's one of the reasons why there's Kendra's law. And that's to protect the mentally ill. And a court can actually get involved and actually require that that person take their medication And then if we do have a person who does refuse to take their medication in a healthcare facility, we, as the provider of nursing care, need to make sure that we write why the person refused their medication. Our patients have the right to be educated about the medications they're being given and that they are being given in order to take it home through a prescription. They have the right to understand what might be possible interactions with not only their other medications, but with herbals. That is a big problem. Many people forget that an herbal medication actually is potent enough to interfere with the other medications. So they forget that they're actually taking a medication when they're taking an herbal product or a natural kind of medication. So it's important that we ask, are you taking any vitamins, any over-the-counter herbal medications? Because we know that they can interfere with medications that may cause a change in clotting profile of a patient. So if they are taking a medication that already thins their blood, this may something like garlic can also affect their clotting profile. So it's important to know. And then lastly, it's important for us to reconcile all of the medications a person takes over all healthcare facilities as well as at home. What medications are you taking at home? What has the patient been ordered to take over at a long-term care facility? Now they're in an acute care facility. What were the medications they were taking over there? What are the medications they're taking here? So that we can keep the communication open. Because remember earlier I said the #1 cause of death is a miscommunication. And in surrounding medications, you've got a patient who is at risk of death. So when we teach our patients, which is imperative, it can help prevent errors. It can help prevent adverse reactions. It improves the person's adherence to the drug regime. And that education needs to include the brand or trade name as well as the generic name, explanations about the amount, the timing of the medication. Do they need to use some measuring devices and the route in which they should take it, the medication? And then we need to follow up on that teaching to make sure that they truly have understood what we have talked about. We need to remember that patients are going to be going home most of the time and that their home health care is increasing because we're sending people home earlier. There are special considerations for the home setting, and we need to be aware of that, whether it be for medication purposes or rehabilitation purposes after the person has gone home. And we want to allow that person to be as autonomous as possible, to take care of themselves. Most of us don't want to be dependent on other people. We have to keep that in mind. How can we help that person to be a person who takes care of themselves? And communication, once again, is critical. So often when we talk about taking medications, I think the first thing I always think about is that we take it either orally or someone gives us a shot. But if you look at the routes of administration, it's amazing how many different ways that we can actually deliver medications to ourselves and to others. And you oftentimes just overlook them. We know we do a lot of this over the counter at home and just forget about how we're doing it. So we can take it orally, we can take it sublingually, which means we take it under our tongue, buccally, which is in the cheek. Parenterally means anytime you have to break the skin, so we can do it by IV, intravenous, IM, intramuscularly, subcutaneously, which is just beneath the tissue right below the skin, and we can do it intradermally, ID, which is right in the skin. We can insert it into body cavities, like the rectum, the vagina. We can instill it into a body cavity, sometimes into an open wound. We can do it put medication in eyes, ears, and noses. That's also intranasally. Topical, like lotions, ointments, and pastes, nitro paste is one that comes to mind immediately, that we put on the outside of the skin. Transdermal is very similar because it's a made patch that has medication that we stick on the patient's skin, or we advise them to, we teach them how to do it. And percutaneously, which is again on the skin or on mucous membranes, and one that's not on the list